Chronic rhinosinusitis with nasal polyps is an inflammatory disease characterized by the formation of nasal polyps, or NP, and eosinophilic inflammation, along with other symptoms like sinus pain, loss of smell and taste, and nasal blockage. These symptoms can negatively impact a patient's quality of life. Current standard of care treatments include topical and systemic corticosteroids and sinus surgeries. Unfortunately, some of these are associated with long-term adverse effects and limited or only temporary disease control. Now, biologic therapies like mepolizumab are approved as add-on therapies for chronic rhinosinusitis with nasal polyps. Mepolizumab is a targeted humanized monoclonal antibody that inhibits interleukin-5, the primary cytokine responsible for the proliferation, activation, and survival of eosinophils. In the recent Phase 3 SYNAPSE trial, mepolizumab improved clinical outcomes in patients with chronic rhinosinusitis with nasal polyps and reduced the need for oral corticosteroids and surgery. However, its sustained clinical efficacy following discontinuation remains unknown. To this end, researchers have now assessed the longevity of mepolizumab's clinical benefits following treatment cessation. After 52 weeks of randomized treatment with mepolizumab versus placebo, 134 patients with severe chronic rhinosinusitis with nasal polyps underwent a treatment-free follow-up for 24 weeks. The researchers compared the clinical improvements in these patients from baseline to the end of treatment and to the end of the treatment-free follow-up. Overall, the mepolizumab group continued to show clinical improvements even 24 weeks after stopping treatment, with substantially better NP scores and lower probability of undergoing sinus surgeries compared with the placebo group. This was despite blood eosinophil counts in the mepolizumab group returning to baseline values. Although improvements in quality of life, overall symptoms, and oral corticosteroid use in the mepolizumab group were larger during treatment than after stopping treatment, these outcomes were still better in the mepolizumab group than the placebo group after 24 weeks of treatment-free follow-up. These findings show that in patients with severe chronic rhinosinusitis with nasal polyps, several clinical benefits linked with using mepolizumab for 52 weeks are sustained for up to 24 weeks after treatment, which may be indicative of potential short-term remission or disease modification. These results also offer a glimpse into the possible durability of mepolizumab treatment response in a real-world setting, where missed doses, treatment holidays, and temporary limitations to treatment access can often occur.